Thank you very much. I have nothing to disclose. To date, we know that male LUTs have a multifactorial origin. However, the potential role of pelvic floor muscle function has not been studied thoroughly, and therefore we explored the muscle of the pelvic floor muscle activity in men with varying severity of LUTs using the MAPLE device. We performed an observational cohort study, including 57 adult men in an outpatient clinic with a mean age of 67 years and an IPSS score of 19.2 and an OA-BSS score of 6.1. And I have to make a small note that only men with an IPSS score of 8 and higher were included for the study. And we found a mean maximum flow rate of 9.4 milliliters per second. All men had a MAPLE measurement, including the 3 tasks you saw before. That is a 1-minute rest task, 5 maximum voluntary contractions, and 3 maximum endurance contractions. And we calculated the average muscle activity in microvoltage for the 5 muscle groups that can be detected or measured with the MAPLE device. Here you see the results. And what you see is that we look at the muscle activity for each task and compared the different muscle groups. And when you look at the MPZ task, we found that the external anal sphincter had a significantly lower muscle activity compared to the puborectalis muscle and the internal anal sphincter. And when looking at C, the endurance task, we see that the external anal sphincter had a significantly lower muscle activity compared to all other muscle groups. And when comparing the 3 tasks for each muscle group, we found a clear difference between the rest activity and the activity during the MVC and the endurance task, and this was the same for every muscle group. And we might have see a trend for the anal external sphincter, where the endurance activity was lower than the activity during the MVC task. We also looked at the association between the pelvic floor muscle activity and the LUT severity measured with the IPSS and the OA-BSS questionnaires. And we used correlation coefficients, but we found no association at all. So to conclude, this is the first study exploring pelvic floor muscle activity in men with LUTs. The external anal sphincter activity was lower during the MVC and the endurance task compared to the other muscle groups. And we found no association between the muscle activity and the symptom severity. However, we cannot rule out, based on this study, that there is not such an association. For future studies, it would be very interesting to compare subjects without problems and to look at patients with different types of pelvic floor problems. And it would also be very interesting to perform a measurement or MAPLE measurement during voiding. Thank you for your attention.
Thank you very much. Are there any questions? I have a question. On the previous presentation, it has been shown that the device is actually not perfect in the sense retest, test, evaluation.
Yes.
So how do you think this conclusion are valid based on previous presentation?
Yeah. The test retest was a sub-study, so it was performed after this study. So we didn't know that at the moment when performing or doing this analysis. I think we have to look into MAPLE more, and we're also performing a new study now in a cohort study looking at healthy or a group of men and women without pelvic floor symptoms and a group with symptoms. And we take into account all that we learn here, and hopefully we can address those points. But yeah, you're right.
But you cannot do use device which tests show it's not really yet ready to do tests, and you're testing already 2 different groups. So how do you know it's not correct or correct?
Yeah, I cannot really answer that question. I'm sorry.
Sorry, yeah, it's difficult. One question. Okay, sorry.
Hi, Paul Hodges from Australia. Just one question. Your data showed differences in the external anal sphincter
Yes.
in men with urinary tract symptoms. Do you think the external anal sphincter measures are meaningful for the urinary tract symptoms, since the external anal sphincter doesn't have an impact on urinary control?
Could be. I'm not really into the muscles itself, so maybe Marco, you can help.
Well, I think you have a good point. For us, it was a more or less a proof of principle that you can measure different muscles, as is stated by Maple. And of course, the external anal sphincter is not the main cause or reason for having LUTs. You're correct. Yeah.
Any other questions? If not, thank you very much.
Okay, thank you.
Thank you. Then